everyone, it is Dr. Lanice. I am an author, speaker, blogger, and I take care of sick babies for a living. I love to help you, preemie moms, moms who are stressed out, tired, frustrated, having a hard time, who have preemies in the NICU. I love to help you better understand what's going on with your preemie, more effectively communicate with your NICU team, and most of all, know that you can make it through the NICU journey and that you do not have to do it alone. So I am back with you today on Wednesday for my weekly Wednesday Facebook Lives that I do right here on my Facebook page at 7 p.m. Eastern Standard Time. So unfortunately, I was unable to do my Facebook Live last week because I was doing what I love to do, and that is taking care of sick babies. So I was at work and unable to do my Facebook Live, but I'm back here with you again tonight at 7 p.m. Eastern Standard Time, where I love to talk about all things preemies, babies, and NICU. And I love to talk about things that I hope that preemie moms want to hear. So if you have ever seen my videos, if you're watching this right now, and there's something that you want to know about or you want to hear about that I haven't discussed, please shoot me a message or write it out in the comments below, and I will circle back and check that, because I want to talk about things that you want to hear about. So we are on, the second day in August, and this month I want to let you know that August is Children's Eye Health and Safety Month. So because of that, I really wanted to take the time out to talk to you preemie moms and preemie parents about what you need to know about your preemie's eyes and development, because this is something that, definitely that we talk about. We do it in our prenatal consults and kind of throughout your time in the NICU. So I definitely wanted to take some time to talk about that with you today, since specifically this is what's being brought to light this month. Okay, so let's get into it. So the first thing that I want to let you know about the development of the eyes is that when the baby is inside the womb during pregnancy, the eyes actually start to develop at about 5 to 6 weeks. So actually the tissue layers that form the eye begin to develop, and then kind of the structures that make up the eye begin to develop. Things like you hear people talk about the lens in the eye, or the retina, or the cornea, all of those things start developing. And then by about 10 weeks of pregnancy, your baby's eyelids will form. So the upper and lower eyelids will begin to form. And then kind of as the weeks progress, they will start to come together and actually fuse and close. This is usually closed by about 14 weeks of pregnancy, and then it will tend to remain closed until about 26 to 28 weeks of pregnancy, where the eyes will open up again. So if you have a preemie, and it's a micro preemie who's delivered maybe somewhere between 23 to 25 weeks, it would not be surprising at all when you see your baby for the first time, the eyes are not open because they will be fused, because that's what normally happens inside the womb at this time. And then usually over the next week or two or so, depending on how old your baby is when they're born, then the eyes will begin to open up. So this is kind of going on. So you can see that eye development is kind of taking place sort of all throughout pregnancy. So what happens is when babies are born early, they're at risk for their eyes not being fully developed at that time, okay? So that puts them at risk for an eye disorder, an eye problem that we see in preemies called retinopathy of prematurity, or ROP, okay? So right now I want to let you know 5 things that you need to know about your preemie's eyes, okay? So the first one is basically, what is retinopathy of prematurity? I'm sure you're thinking this is a strange term. I don't know what it is. It sounds complicated. So we're gonna discuss it. So basically, I talked about the structures of the eyes that develop, right? So basically what happens when you're born, when the baby is born early, as a preemie, the blood vessels that supply that part of the eye that I talked about, the retina, which is actually towards the back of the eye, they are not fully developed and they're not fully formed. And so when the baby is born, if there's injury to those blood vessels, they will actually go through a period of time where they sort of stop growing. Okay, and then over the next few weeks or so, different factors are being released in the eye, and then the blood vessels will start to grow again. But when they actually start to grow, they sort of don't grow along the normal path that they should in the eye along the retina. Instead, they kind of grow haphazardly, sort of wherever they want, and sometimes towards the center of the eye. And they grow abnormally, and you actually get extra blood vessels that develop. And so this process of that happening and taking place is called retinopathy of prematurity. So the retina has photoreceptors in that layer of the eye, and basically it receives the light, and it's also responsible for sort of transmitting sort of visual signals from the eye and the brain. So obviously, right, this is in a very important part of the eye, and so when your preemie is born early, they're at risk to kind of have injury to it. So what causes this injury? So we already know, right, when preemies are born, especially when we talk about micro preemies who are very small, they can be very sick and they can kind of have a rocky course, especially in the very first few days of life. So sometimes they need lots of breathing support, they need high amounts of oxygen levels, sometimes their blood pressure is very unstable, so we have to actually give them fluids and medications to kind of help improve their blood pressure. And sometimes what happens is they kind of go through swings, right? Their oxygen level gets better, so we turn it down, and sometimes we have to go back up, or we give them the fluids, we give them medications for their blood pressure, that comes up and gets better, and then sometimes they bottom out after that. So when those changes happen, that puts the eyes at risk, those blood vessels to be injured. Another thing as well, we know in preemies, they tend to be anemic or have low blood counts. I've talked about that before, where their hematocrit is low. And so again, being anemic as well, all of those things can cause injury to those blood vessels in the eye, and then as a result, they'll go through this time frame or period where they kind of stop growing, okay? So this is what I mean by retinopathy of prematurity, all right? So that's the first thing. The second thing that I want you to know is, so which preemies will be affected by this? How do you know if your preemie is at risk, right? So we've defined before that we consider any baby to be a preemie who is born before 37 weeks of pregnancy, right? So that's going to be 36 weeks and below. But that doesn't mean that every single one of these babies are at risk to develop retinopathy of prematurity or ROP, okay? So there's two things that we look for to figure out which preemies are going to be at risk. And one is those babies who are the youngest. Those babies who are born at less than 30 weeks of pregnancy are at risk. And then also those babies who are the smallest, right? Those babies who are less than 3 pounds or 1,500 grams. So that's the criteria that we use to say, we know these babies are at risk to get ROP, so we're gonna follow them and watch their eyes closely. However, it can also kind of be either or sometimes. So even if we have a baby who might be 32 weeks or 34 weeks even sometimes, your OB doctor might tell you, well, we're watching your baby closely because they're not growing well, right? And that might be one of the reasons that they're actually delivered early and that you don't go to term, is because something's going on and the baby's not growing or gaining weight well. So even though they're older and they should be more mature from the prematurity standpoint, their weight might be very low. And so they still might meet that weight criteria, again, where they're sort of less than 3 pounds or 1,500 grams. Sometimes they can even be a kilo or 2 pounds. So again, those babies as well are still going to need to have their eyes looked at. And then again, even for babies, again, who might be 31 or 32 weeks and who might be over 1,500 grams, but they're very, very sick and very, very unstable, and they required a lot of oxygen support or a lot of blood pressure support, and they're just very sick, then sort of on a case-by-case basis, your NICU doctors might say, well, you know what, this baby, at 31 or 32 weeks didn't have the typical course that another preemie at that age should have. And so this might put them, at a higher risk for their eyes to maybe not be developed or to have ROP. So that will be a baby that we'll want to watch and examine as well, okay? So one, we talked about what is ROP and then which preemies are going to be at risk. Again, the key two things that we look for: babies less than 30 weeks gestational age, and those babies who are weighing less than 1,500 grams or 3 pounds, okay? So then the third thing is, how do you know, right, if your preemie has ROP? How do you know if your preemie is affected? And so again, when you just by looking at your baby, you can't tell just by looking at the eyes from the outside, there's no way for us to know. So just like if you are an adult who wears glasses or you wear contacts and you have to go into the doctor, right, and get your eyes examined and sometimes have drops put in for your eyes to be dilated, it's very similar, right? So your preemie's eyes have to be examined. So typically this will happen at about 4 to 6 weeks of age. And the reason why is, remember, we talked about the fact that when they're born, and there's that injury that kind of can take place to the blood vessels, they go through a period where they stop growing. So if we were to start looking at the eyes immediately after a preemie is born, we wouldn't see these changes that they're at risk for the ROP. So, we have to give it some time and to watch when we know the blood vessels will start to grow again. So based on how many weeks your baby is when they're born, it will either be somewhere between 4 to 6 weeks where they will get their first eye exam. And then basically the eye doctor, not your NICU doctor, but the eye doctor or the ophthalmologist is going to be the one who will be examining your preemie's eyes. And so they will come in at that time into the NICU while your baby's there, and at the bedside, they will examine the eyes. Okay, so again, just like how you need to have drops put in your eyes, the babies need to have drops put in their eyes as well, right? So for the eye doctors to be able to get a good look so that they can see what's going on, they have to put drops in to dilate the eyes. And again, they have to use tools to kind of keep the eyes open to help them look. So we also might use another drop that's kind of more like a numbing medicine to kind of make it a little bit more comfortable for the babies when they examine, so they can kind of take a look. So one thing that we always will warn our parents about is, again, we try to use the numbing medicine and try to make it as comfortable for the babies as possible. But you can think about when you go and you have to stare and the light's shining in your eye and all these different things are going on, even for us as adults, right? When you have an eye exam, you might feel like a little bit tired. It's kind of exhausting to kind of have your eyes checked. So it can be the same thing for the babies. It can kind of be stressful for them to kind of have to go through that process and have their eyes manipulated and all those different things. So after that, those babies kind of tend to have a hard day, meaning, sometimes they might not tolerate their feeds as well afterwards, or in addition to that, they might have some of those events that we've talked about in other videos before, right? So where they have drops in the heart rate or drops in the oxygen level or pauses in their breathing, those events, they might have more of those on days where they have their eyes examined, again, because we know it can kind of put a little bit of stress on the baby to have those eye exams. And then typically by the next day, they have recovered. But again, if your baby is on breathing support at the time they get their eye exam, sometimes we may have to go up a little bit on the settings or a little bit on the oxygen. So try not to be freaked out by that. Again, we know it's a little bit stressful, and so we expect that to happen. On the same token, though, if we have a baby who is very, very sick and they're on like maximum breathing support, and again, their blood pressure is unstable and other things are happening, we might say, today might not be a good day to do the eye exam. Let's actually wait, unless we already know that there's some severe changes to the eyes. We might say, let's wait, let's push it back a week, just because we already know that doing the eye exam might be a little bit more stressful on the baby. But typically, again, the eye doctor is going to come into the NICU, they'll do it at the bedside, drops and things will get placed, they will do the exams, and then they have a way that they sort of grade them so that we kind of know where they are or how at risk they are for ROP. So what they do is they sort of categorize it into zones and stages. So when they look at the zones, it kind of gets us information about where in the eyes there's changes or there's injury. And then they do stages, which is how severe the injury, the ROP, is. And it's on a scale of 1 to 5, right? So a stage of 1 to 2 would be like milder changes, right? So mild abnormal blood vessel growth would be like stage 1, a little bit more moderate would be stage 2, and then more severe changes would be stages 3 to 5. Okay, and the reason that we kind of grade this or follow this is because we know that babies are at risk to get something called retinal detachment. And this is basically where the retina, that layer of tissue in the back of the eye, can separate from the wall of the eye. And actually, I have a picture here that I kind of wanted to show you structures of the eye, just so you kind of have an idea of what I'm talking about. So it might be a little bit hard to see. But like I mentioned before, you can have these different structures in the eye, right? So we talked about the lens. If you look here, if you can see this towards the back, this is actually the optic nerve. And then so when you look, this layer around the eye that kind of looks orange, this layer at the back of the eye actually represents the retina. And so then you can see these sort of squiggly red lines in here are the blood vessels. So up here, growing out along the periphery of the eye, this is what we would expect for kind of normal blood vessel growth. And then you can kind of see here that the blood vessels toward the bottom look a little bit different, and they're kind of going towards the center of the eye. And that's the abnormal blood vessel growth that we worry about for ROP. So basically, at stage 3, we know that's severe abnormal growth of the blood vessels. And when that happens, we know that, again, when these blood vessels are injured and they're growing abnormally, these vessels can leak and bleed. And that actually leads to scarring in the eye. And then what happens is, as there's scarring there, this scar can actually pull on that layer of tissue, the retina, and cause it to separate from the wall of the eye. And so you can have partial separation or complete separation. And when we have the complete separation, this is what we call retinal detachment. So we obviously want to prevent that because that can cause blindness. So we follow the progression of the baby's eyes, so that if, they start to see that the baby is progressing to a stage 3, there's different things that the eye doctor will kind of look out for, and then they make a management plan on what to do based on that. Okay, so we've talked about number 1, what is ROP, abnormal growth of blood vessels that supply the retina in the eye. We've talked about number 2, which preemies will be affected, and that will be those preemies who are less than 30 weeks or less than 3 pounds or 1,500 grams. And then we talked about number 3, we talked about how do you know if your preemie has ROP? The fact that the eye doctor is going to kind of look at your preemie's eyes and evaluate them and examine them and kind of give them a grading, a stage to kind of see how severe any injury there is. And then 4, how do we treat it, or how are the eyes managed? So babies who have stage 1 or stage 2, this typically, as the baby's eyes grow and develop, it tends to resolve on its own. A lot of times we don't need to do anything about that. But again, when we talk about stage 3, that's a little bit more severe. So when they're looking at stage 3 and they might see the scarring that's developing and they're worrying that this might progress to the point where it might lead to some separation, right, of the retina from the wall of the eye, then there's things that they can do. And one of the things that they will do is they can actually do some laser surgery treatment to the eye to sort of stop that abnormal growth of blood vessels in the periphery of the eye. So they do that because they know that, again, once these abnormal blood vessels continue to grow, they can grow in towards the center of the eye and cause damage there and more scarring there that can lead to this retinal detachment. So unfortunately, as you can imagine, right, if you're using a laser to the sides of the eye, the periphery of the eye, to kind of stop those abnormal blood vessels, you might stop them, but you also might have some loss of vision, right, in the baby's peripheral region of the eye. And it's kind of where we weigh the risks versus the benefits, right? So we say, yes, we know there might be some vision loss there, but the goal is to sort of protect or preserve the vision in the center of the eye and to prevent, again, blindness, which can happen with this retinal detachment. So this is one of the ways in which they will try to treat it, to sort of stop that abnormal blood vessel growth in the eye. Something else that they can do is there's a medication that they can inject into the eye. And that, again, also functions by stopping this abnormal blood vessel growth. And so, if this is something that your preemie needs, then obviously the eye doctor will kind of discuss with you the options and what they would recommend. But again, the thought process is, if we're using this medication to inject into the eye, then you may have potentially less loss of vision right in the periphery that you can sometimes see with the laser. But again, this is also to treat the eye, preserve or protect the central vision, and again, prevent the retinal detachment. So if the eyes continue to progress or don't respond to the treatment to the point where you have that partial separation, a partial retinal detachment from the eye, then there's surgical procedures that they can do to sort of kind of fix the eye in place and to sort of help it to reattach. And so sometimes that's successful. And then, if you're at the stage where you've had complete separation, where there's retinal detachment, obviously there's nothing that you can do at that point to reverse the injury that has already happened. But again, there's different surgical procedures or things that they can do to try to preserve small amounts of vision, or what parts of the vision that they can. And again, that would have varying rates of success. Okay, but basically this is how we treat it. We expect for stage 1 and stage 2, and even sometimes stage 3. If it doesn't progress, sometimes that will resolve as well and doesn't always need intervention. So some of those will self-resolve, and then when they see it's progressing and the injury is becoming more severe, they have different criteria that they use to decide now is when we either need to do the injection or to do the laser, or if more severe, what we call that stage 4, that partial separation, or 5 where it's completely separated, then that's where they kind of go in and do surgery at that time. Okay, so that's sort of the management and the treatment. And then sort of the fifth thing that I want you to know is kind of what can you expect right then for your baby's vision in the future. So for those babies who have needed some type of intervention, right, like a procedure where they've had partial detachment or complete detachment, or they needed the laser or the injection, that's obviously going to be different. It's going to depend on your baby and what that injury is. So your eye doctor and your NICU doctors will talk with you about that time, about kind of what to expect, and then based on your baby's eye injury, sort of what is their risk for blindness in the future, or what kind of vision loss you might be able to expect. For those babies who you may have had stage 1 or stage 3 that sort of resolved and got better, we said that they're going to continue, the eye doctor is going to continue to follow the eyes until they're fully developed, or the term they use for that is completely vascularized. So they'll examine the eyes and they continue to follow it on a weekly or every 2-week basis until the eyes are fully vascularized. And then once they say, what, the eyes are fully developed there, it's vascularized, then your baby won't need to have another eye exam until another year. And the reason why is we know that even though they're not at risk for this retinal detachment and things anymore, they will still have some other vision changes, right? So just like adults can have changes with their vision and need to wear glasses and things like that, preemies are at risk for that as well, right? So they could be farsighted or they could be nearsighted. They could have issues with the eyes that we call strabismus, which is basically where you look at the eyes and they kind of tend to drift, right? So they may drift outward or they may drift inward, right? So those are those babies where you look and the eyes look cross-eyed. So that's basically one of the things that can happen. And so they want to watch and do appropriate interventions to sort of treat and preserve the vision. And so that's why they'll follow up at a year. And then after that exam, they'll continue to tell you how often your baby needs to follow up, right? And you can all think about all those cute pictures of babies that we see. They're so small, but they have their little glasses on in place, and that's basically why. So we know they're still at risk for those changes, so that's why they need to have their eyes examined, right? So 5 things that we want you to know. We want you to know what is ROP, which preemies will be affected by it, what preemies are at risk, how we know, and that's because the eye doctors will examine the eye and then they sort of grade it. They give zones and stages to let us know how severe the ROP is. 4, how do we manage and treat it? And then 5, kind of what can you expect in the future? So I know that this was a lot of information, but honestly, right, we see this all the time in the NICU. This is a big thing that we talk about and that we see. And sometimes it sounds like a foreign language. So I really wanted to talk with you about this today so you can have an idea. You can hear it. The more times you hear something, the easier it is to understand. So I hope that you enjoyed it. I also did a blog about this as well. So I know some people, they like to hear things and some people are more visual. They want to read it. So if you prefer to do that, please feel free to go to my website at www.drlanisemd.com/blog and you can check it out there. Or you can listen to this video where I actually went into more detail and described more than I actually did when I wrote the blog. But again, the month of August is Children's Eye Health and Safety Month. So please share this with other people so that they can learn about this as well. Please don't forget to check me out. I am all across social media as at Dr. Lanice MD. That's the at symbol, DRLAUNICEMD. Like my Facebook page, follow me so that you can see what I have coming up next and what I'm talking about. Again, if there's certain things you want to hear about, please leave it in the comments or shoot me a message. If you are a preemie mom, I have a special freebie for you. It's my free audiobook, 10 Things You Need to Know Before Your Preemie Comes Home. You do not want to miss out on this opportunity, so you can check that out at www.drlanisemd.com/free audiobook. And if you download that, you will also get an extra bonus, 10 preemie tips for a preemie mom. So you don't want to miss out on that. So again, thank you for checking this video out. Don't forget to see me again next week on Wednesday, right here on my Facebook page, for another Facebook Live at 7 p.m. Eastern Standard Time. So thanks for checking this out and have a good evening. Bye.